Welcome to another Explainer. So, if you've been following the news lately, you've probably caught those alarming headlines about a deadly virus outbreak on a luxury cruise ship, the MV Hondius. It's exactly the kind of story that grabs your attention and, let's be honest, kind of picks off a little bit of panic. But today, we're going to cut right through all that noise. We're bringing you a structured, fact-based breakdown of exactly what's happening, what the World Health Organization is saying, and why you really don't need to hit the panic button.
Okay, let's dive into this. We'll be looking at the MV Hondius outbreak itself, exactly why this is absolutely not COVID, a timeline of the voyage, the specifics of the Andes strain, and finally, the global tracing efforts currently underway.
Section 1. The MV Hondius Outbreak.
You know, whenever we hear about a virus spreading on a confined luxury cruise ship, our minds instantly jump to the absolute worst-case scenario, right? It brings up the elephant in the room. Is this the start of another global pandemic? Look, it's a completely valid anxiety to have. But let's look at what the top experts are actually saying to de-escalate that fear.
The UN Health Agency wants to firmly squash any comparisons to what we all went through a few years ago. Maria van Kerkhove, an infectious disease epidemiologist at the WHO, stated very clearly, "This is not COVID, this is not influenza, it spreads very, very differently." They're being incredibly direct here just to make sure we all understand the specific nature of this virus.
Now, that being said, the situation on the ship is still very serious. The WHO confirmed 5 cases out of 8 suspected ones on board, and tragically, 3 people have died. That includes a 69-year-old Dutch woman whose Hantavirus infection was confirmed, along with her husband and a German woman whose cases are still being actively investigated by authorities.
Section 2. Why it is not COVID.
To really get this, we have to look at the biology of how this virus actually moves from host to host, because the transmission methods are vastly different from what we're used to lately. COVID-19 is, of course, an airborne respiratory disease. Hantavirus, on the other hand, typically requires exposure to rodents, or, in very rare cases of human-to-human transmission, it requires close, intimate contact. It literally does not spread through the air across a room the way COVID or the seasonal flu does.
Because of how it transmits, the WHO Director General, Dr. Tedros Ghebreyesus, officially assesses the public health risk as low. He pointed out a massive piece of the puzzle. The first 2 people with the confirmed virus had actually just traveled through Argentina, Chile, and Uruguay on a bird-watching trip. And crucially, that trip included visits to specific sites where the exact species of rat known to carry this virus was present.
Section 3. Timeline of the voyage.
Tracking the ship's physical journey is absolutely vital for understanding how global health authorities are managing the containment right now. Here is how it all unfolded. The luxury cruise, operated by Oceanwide Expeditions, began on April 1st, departing from Ushuaia, Argentina. The first unconfirmed death, which was the husband of the Dutch woman, happened on board on April 11th. By April 24th, dozens of passengers disembarked at the island of St. Helena. But it actually wasn't until May 4th that the very first case was officially confirmed, right before the ship's expected arrival in Spain's Canary Islands on May 10th.
Section 4. Explaining the Andes strain.
This is where the biology of this specific outbreak gets really fascinating from a scientific perspective. As we established, hantavirus is typically spread from rodents, but the specific strain behind this outbreak is the Andes strain. And what makes the Andes strain so incredibly unique is that it possesses the very rare, documented ability to be transmitted from person to person through that close, intimate contact we just talked about.
And this brilliantly illustrates why health authorities around the world are paying such incredibly close attention. According to the WHO, this marks the first known transmission of this virus on a boat. It is literally a medical first for maritime environments, which completely changes the playbook for how it's handled.
Section 5. Global tracing efforts.
Because passengers actually left the ship midway through the journey, there is an incredible logistical operation happening across the globe right now. The massive scale of this comes down to this number, 150. There were initially about 150 passengers and crew members on board, hailing from 28 different countries. When you have dozens of those passengers disembarking in St. Helena on April 24th and then catching flights all around the world, contact tracing becomes this massive international effort.
It's a huge global web. In the UK and France, individuals are already self-isolating or in quarantine. Over in the US, authorities are monitoring passengers from Georgia to Arizona while organizing dedicated transport. And the focus isn't just on the ship itself. Places like Singapore and the Netherlands are actively tracking down and testing people who merely shared commercial flights with the affected passengers.
So, the crucial takeaway here is that immediate, highly structured safety procedures have been enacted.
Ocean-wide expeditions and health authorities mandated masks for everyone left on board. They required high-level personal protective equipment for anyone caring for suspected cases. And because the incubation period for this disease can be up to 6 weeks, they are fully committing to long-term monitoring of all contacts.
Which leaves us with a really critical look forward. Now that the first ever boat transmission of the Andes strain is a documented fact, how will global maritime protocols adapt to stop the next outbreak before a ship even leaves the port? Thanks for focusing on the facts with me in this explainer today. The world of public health is always evolving, and understanding the science is our absolute best tool for staying safe without panicking. Keep asking questions, keep looking at the data, and we'll catch you next time.